welcome to tonight's episode of the University of Technology's annual quiz competition. I'm your host, Renisha Russell, and tonight on our final event, facing off, we'll be having the purple team going against the yellow team. Our topic for tonight's quiz will be focused on deep vein thrombosis. At this time, I'd like to ask the team members to introduce themselves, starting with the team Purple with Captain Janelle Small.
Good night, everyone. My name is Janelle Small. I'm 21 years of age. My hobbies include reading and surfing the internet. In the future, if God's willing, I'd like to be a registered nurse. Thank you.
Good evening, everyone. My name is Shannon Brissett. I am 20 years old. My hobbies include watching television and scrolling through Instagram. In the future, God's willing, I would love to become a firefighter. Thank you.
Good night, everyone. My name is Kadian Smith. I am 21 years of age. My hobbies include reading and watching the television. In the future, God's willing, I would like to become a pilot. Thank you.
Thank you, Purple Team. Now moving over to the yellow team with Captain Abrinia Armsby.
Good night, everyone. My name is Abrinia Armsby. In the future, I would like to become a pilot. My hobbies include watching the TV and surfing the net. Thank you.
Good night, Jamaica. My name is Tiana Williams. I am 22 years of age. My hobbies include reading, singing, watching the television. In the future, God's willing, I would like to become an entrepreneur. Thank you.
Good night, everyone. My name is Shanae Richards. I'm 21 years of age. My hobbies include reading and watching the television. In the future, God's willing, I would like to become an attorney. Thank you.
Good evening, Jamaica. My name is Euthania Thompson. My hobbies include studying, surfing the net, and playing football. In the future, God's willing, I will become a neurosurgeon. Thank you.
Thank you, teams. So, earlier, we had the coin toss and the purple team won, and they're deciding to allow the yellow team to go first. But before we get into that, here is a question for our viewers. What are the dietary restrictions while taking warfarin? The number to call is 444 UTEC or 444-8832-4. The winner for this question will receive a gift prize from LASCO. Now, here we'll be going into our first section where questions will be thrown open to both teams earning the right to answer, gaining 1 point. Starting with the yellow team. What is the pathophysiology of deep vein thrombosis?
The pathophysiology involves the complete stasis of venous and arterial blood flow in the lower extremities, and based on the virtuous triad, the main pathophysiological mechanisms involved in deep vein thrombosis are damage to the blood vessel wall, blood flow turbulence, and hypercoagulability.
Correct. Purple team, your question. What are the risk factors for deep vein thrombosis?
Risk factors for deep vein thrombosis include 1. Recent surgery, as the injury to veins during surgery can increase the risk of blood clots. 2. History of contraception use. 3. Smoking. 4. Obesity. Thank you.
Correct. That ends the first section. Now we'll have a commercial break.
Live on the pull out party big on the seal of the streets. Don't be a top Red Bull and break.
Happy cheese, and that them call me.
party with me. When everybody want way, but we know no beef. We know no beef. Fish party, power party, and power party cheese. Chick, mother's chicken party and party for every smarting mama dollar and daddy come on mother's and grabby and party for everybody. Yes, the delicious party line of only others. The Great Jamaican Party Company. Live on stage.
Okay, welcome back everyone. Now we'll be having the speed challenge. In this section, teams will be given 2 minutes to answer as many questions as possible, earning 2 points for each correct answer and losing 2 points for incorrect answers. We'll be beginning first with the yellow team. Here we go. Question number 1. What are the assessments and diagnostic tests used for deep vein thrombosis?
These include Wellington screening test, D-dimer blood test, the duplex ultrasonography.
Correct. Describe how the Welling screen test is used.
Well, screen testing looks at the similarities and differences between the lower extremities. Some differences may include swelling or the presence of heat.
Correct. How is the duplex ultrasound used?
Duplex ultrasonography identifies blood clots by monitoring the blood flow in veins.
Correct. Final question. What is the D-dimer blood test?
D-dimer blood test measures plasma D-dimer in the blood. The elevated levels indicate a deep vein thrombosis.
Correct. Now we'll be moving on to the purple team for their 2 minutes. Purple team, first question. What are the pharmaceutical treatments option for deep vein thrombosis?
Some pharmaceutical treatments of deep vein thrombosis include some medications such as heparin, enoxaparin, fondaparinux, dabigatran, Xarelto, Eliquis, edoxaban, and urokinase.
Correct. What are anticoagulants?
An anticoagulant is a medicine that prevents or reduces the risk of blood clots.
Correct. True or false? Warfarin is a blood thinner.
True.
Correct. How does the blood thinner work?
Blood thinners work by preventing the blood clots from getting bigger, and it also prevents new ones from forming.
Correct. Final question. True or false? Blood thinners are only taken orally.
False.
Correct. And this ends our speed challenge. The scores at this time are yellow team on 9 points and purple team on 10 points. We'll now have another commercial break, and when we come back, it's the exciting buzzer challenge.
Oliver Orange, me are the king of the show. I quench me all of them thirst from head to toe.
In Rudy Fresh Plastic, we got the wickedest vibe ever ready for the girls when they want to imbibe.
Excellent, you know we mucho insane. We got the razzle and that's running through our veins.
Yo, Pablo,
Whoa, bro. You sound thirsty, man. The wicked taste of fresh juice drink bound to cool you down.
Salute the fruit. Salute the fruit.
Welcome back, everybody. Now we'll be having the buzzer challenge. In this section, questions will be thrown open to both teams. When they press the buzzer, they'll earn the right to answer the question. Each correct answer is valued 3 points, and incorrect answers, teams will lose 3 points. The time is now set on the clock. Here goes. Our first question. Identify strategies to prevent deep vein thrombosis. Purple team.
Yellow team.
Yellow team.
Strategies to prevent deep vein thrombosis include wearing compression stockings, exercise, avoid sitting for over 4 hours, avoid sedentary lifestyle, and a person can also modify factors such as weight loss and eating healthy.
Correct. Next question. What can occur if thrombosis become an embolus? Purple team.
If thrombosis becomes an embolus, what occurs is that small pieces of the blood clot actually travels towards the blood vessel, which it automatically blocks the blood vessel and no blood will be able to flow through the vessel anymore, which can actually damage the body organs.
Correct. Next question. What is an IVC filter and its purpose? Yellow team.
An IVC filter or an inferior vena cava filter is a small medical device that is implanted into the vein in either your groin or your neck to prevent a blood clot.
That is correct. Okay. We've come to the end of our competition for tonight. We're going to go to a commercial break while we tally the scores.
A deep thrombosis is the formation of blood clot within a deep vein, which usually occurs in the legs. Blood clots can be caused by anything that slows blood flow, such as sitting for extended periods, like on a plane. They can also in surgery. Risk factors include obesity, a family history of the condition, taking the oral contraceptive pill, and pregnancy. DVT can cause swelling of the affected leg. These areas can also feel warm or tender, or there may be a change in skin colour. If left untreated, a deep vein thrombosis may dislodge and travel through the body to block the blood supply to the lungs. This can be life-threatening. Treatments include medications which prevent new blood clots from forming while your body naturally breaks down the existing clot. Wearing compression stockings can also help. To help prevent DVT, walking for 30 to 60 minutes per day to improve circulation in your legs is a good idea, as well as circling your feet and ankles when seated.
Welcome back, everyone. This ends our competition for tonight, but before we announce our winner, here is our viewer's question. What are dietary restrictions when taking warfarin? Warfarin is an anticoagulant drug with the brand name coumarin, taken to stop blood clot and to treat blood clot disorders. Warfarin additionally works to reduce the danger of clots causing stroke or heart attacks. Warfarin can help to prevent dangerous blood clots. It works by slowing the assembly of clotting factors, which the body makes by using vitamin K foods. Level of vitamin K in person's diet could influence the effects of warfarin. People taking warfarin must avoid eating too many foods that are high in vitamin K, but it's not compulsory to avoid these foods entirely. A stable diet containing around 60 to 80 mcgs of vitamin K is desirable. People on warfarin should also make sure that they only consume alcohol carefully. High levels of alcohol may affect the metabolism of warfarin and increase the danger of major bleeding. And the winner for this question tonight is Sharma Jones, and she will be receiving our gift basket from Lasco. Now, the point standings after the buzzer section is the yellow team on 16 points and the purple team on 13 points. Congratulations to the yellow team and well played to the purple team. Now we'll have a word from the captain of the yellow team.
So firstly, I would like to thank God for giving us the knowledge and strength. Secondly, I would like to thank our coach, Miss Balachandar, teammates, good job, and that's it.
Okay, so I want to thank everybody for watching our show tonight. This ends this season of the University of Technology's National Annual Quiz. See you next season. Have a blessed night.